All right. Good afternoon, everyone. Welcome. Happy Friday. I am here today to have the honor to present to you all Dr. Elisa DeVargas, someone who is very important to our internship training program and has a presentation today that I feel is essential for our work that we do here in New Mexico. A little bit about Dr. DeVargas. Dr. DeVargas is a licensed psychologist here at the University of New Mexico in programs for children and adolescents. She completed a PhD in counseling psychology from the University of Oregon in 2018. She is originally from New Mexico and returned here in 2017 to complete her predoctoral internship training here at UNM. After graduating, she decided to stay in Albuquerque to complete a postdoctoral training at the New Mexico Veteran Administration in the family and couple therapy track there. Dr. DeVargas specializes in the provision of Spanish language services, couple and family therapy, and child and adolescent mental health. Her clinical interests include child and adolescent development, parent skills training, and family therapy. Much of her clinical practice is focused on treating childhood trauma, and she has a particular passion for providing anti-oppressive interventions that promote empowerment and social justice. Her research interests include substance abuse prevention, treatment outcomes, program development, and Latinx mental health. Dr. DeVargas has a personal connection to today's topic and has engaged in both formal and informal learning on traditional healing. And I am so excited to have Dr. DeVargas here to present to us, and I will turn the floor over to her.
Thank you, Lindsay. I appreciate that. Good afternoon, everybody. I'm going to kindly recommend that you all turn on your cameras. That's more for me because I like to see people's faces, and part of what I love about doing presentations like this is the interactional piece. So if you feel comfortable, thank you so much. And if not, no pressure. I'm going to go ahead and share my screen. And as I do this, I want to mention that my personal connection to this topic is through my great grandmother, Celestina, who raised my father. She was a curandera herself, so a traditional healer. And growing up, I learned a lot from my dad through the teachings that she gave him. I don't know exactly how she practiced, and we'll talk about the different modalities and types of curanderismo. But from what I've gathered, I'm guessing she was an herbalist or a yerbera, and then probably did a little bit of everything else. My personal experiences aside from that are in connection with two of my best friends who are currently practicing and are affiliated with Abuelas Medicina here in Albuquerque. And then I've done some self-study, just looking at research studies that have looked at the connections between traditional healing and mental health, as well as culturally competent interventions, both in medical settings as well as in mental health settings. So thank you so much for having me here today. I'm excited and a little nervous, so I'm going to try to talk slowly and be patient with myself as I go through this. I want to start off by just saying I don't have any financial arrangements related to the content of this activity. And I also want to provide a disclosure that I do not identify as a curandera, and I am in the very, very early stages of really learning and implementing these practices in my own healing. And so I don't identify as a curandera, and I haven't started practicing in the sense of providing treatments to others. So I want to recognize that and acknowledge that there may be some information that I don't know or answers that I can't give, but I'm presenting as best as I can in this short period of time. So there are several objectives for the presentation today. First, I want to define curanderismo so that you all know what it is I'm talking about today. And then I'm going to describe the different treatment modalities that are used by curanderas, curanderos, and curandereros. Then I will discuss cultural syndromes and how those relate to our typical mental health diagnoses and what we see through the ICD codes and DSM codes, kind of looking at that translation between traditional healing language and our Western language. And then finally, I want to provide you all with some recommendations for how to assess and interact with individuals who may be receiving these sorts of treatments or who may have beliefs that are in line with traditional healing practices. And these recommendations come from the framework of really wanting to empower our clients and provide services that they can relate to and understand in a way that's going to be meaningful. So before we jump into what curanderismo is, I would really like to start with a brief ceremony, a cleansing ceremony. And in curanderismo terms, this would be called Olympia. So as I get us oriented to this limpia, what I want to encourage everybody to do is set their minds and their thoughts on releasing any negativity, whether that's within you or in your environment. And I will start this limpia in just a minute, but I am also going to orient you to some of the things you might see today throughout our conversation, as well as we start this practice. So I've got this bandana on my head, and I know I look really cool, but it's not the cool factor that is the reason that I'm wearing this. So in traditional practices, the color red is a protector. So I am wearing both a cover on my third eye as well as on my sacral chakra as a protection of those energies as we go into the practice today. I also spent some time before this meeting cleansing my office as well as doing some grounding for myself so that I come in with a positive mindset and with a clean and open mind. I'm also wearing a drape around my waist. Generally, when we do limpias, curanderas or practitioners will wear a skirt or some kind of covering around their waist. And what this does is it helps the root chakra connect more with Mother Earth and with the energies around us. So even male curanderos will wear something around their waist and then typically will have like white pants, or if it's a woman curandera, a skirt or a white dress to symbolize purity and kind of start that cleansing process. The other thing I want to draw your attention to is I've brought a few items from my altar that I have at home. Generally on the altar, we want to have a representation of all of the elements. So wind, earth, fire, and water. Because I'm in the hospital setting, I can't light any fires. So I've got my sage stick here with some ash on the end that represents my fire. And the sage also represents earth. I have some rosemary as well. And then I've got my shell that I put a little bit of water into. And then it also has these holes on the side that I feel like can represent air and wind. And then lastly, I have a few trinkets here or symbols of my ancestors. So I've got this. It's a little heart that has a little bit of my mom's ashes in it. And then I have my San Martin, who is the peacemaker. And that comes from my mom and my grandma as well. And then I have a little tincture here, which is for happiness. It's a rose oil that I got from a friend who is a practicing curandera. So we're going to start this limpia today. It's going to be very brief. I'm going to use a singing bowl. As you listen to the singing bowl, you can feel free to close your eyes. And again, focusing your attention, your thoughts, and your energies on really releasing any negativity, whether that's in yourself or in your environment. And even if you don't feel negativity, what we're doing is just trying to cleanse the space. So really inviting in purity and cleanliness into this space. The other thing we're going to do is set an intention. So today our intention is going to be to be present in this moment with an open mind to learn about something new, as well as to be present with our own reactions to this new information. And also to set the intention to be open and understanding and avoid any cultural appropriation. So I'm going to go ahead and start with the singing bowl, and I'm going to do this for about a minute or so. And what you can imagine too as a visual is that the sound waves and the vibrations are carrying out any negativity and cleansing the air. So we're going to do this for about a minute. All right. Thank you so much for doing that with me. Another thing I forgot to mention is that I've got my shoes off, so this is another way of connecting with the earth. For those of you who know me, I generally sit in my office with my shoes off, but today it's intentional. And then generally for a ceremonia or a cleansing ceremony, we would also invoke our ancestors and call out to the 4 directions. So again, we're doing an abbreviated version of this. And again, I'm not a practicing curandera, so really this is a grounding and an intention setting. Let's jump into the content of this presentation. What is curanderismo? So first off, it's a traditional healing practice. And this practice stems from the belief that our health is not only a culmination of the connection between mind and body, but it's also a culmination of mind, body, and spirit. So every ailment that is treated with curanderismo, the belief is that something is disconnected within the spirit, and that trio of mind, body, and spirit has some kind of disruption. Curanderismo is comprised of rituals and treatments that combine indigenous African, Catholic, and Spanish influences. And it exists across Latin America, Southern Europe, and the United States. What you'll see is there are variations in how curanderismo is practiced based on whether it's more of an indigenous influence versus an African influence. And there are different names for curanderismo or traditional healing depending on the culture. So for example, in Cuba or Puerto Rico, they have Santeria, which is a form of traditional healing that is practiced in the Caribbean, and that often has more of the African influence just because of geographical location. And then this type of healing practice tends to be the preferred treatment of mental health among highly religious or spiritual individuals. And often you can see a connection between immigration status, so newly immigrated folks and folks who are more connected with their lands of origin may have greater connection to this type of practice. So curanderismo is often practiced by curanderas or curanderos. And oftentimes what we're finding is that curanderos or curanderex are often people who identify as non-binary or transgender or two-spirited as well. I had updated my slides, and this isn't showing it, but in Spanish, instead of the X, you would have an E at the end, an E. So it's curandera, curandero, and curanderes. So what are these folks, or what does this title mean? So this means that this person is a traditional native healer or a shaman, and they have dedicated their lives to treating mental, emotional, physical, and spiritual illnesses. Oftentimes through intergenerational teachings, as well as through like being identified as this healer or having special properties and experiences that allow you to connect on a spiritual level with other individuals. And then it's believed that when practitioners are doing curanderismo, that you enter into different dimensions of the universe and of our mental and spiritual state. Historically, curanderas, curanderos, and curanderex have been persecuted and called brujas or brujos, brujex, which is basically Spanish for witches. So this practice almost got eradicated during colonization, where many individuals took these practices and infused the Catholicism to kind of camouflage it and be able to practice it alongside the Catholic Church. And then other practitioners have just gone underground altogether because of the stigma. And so oftentimes people who seek this type of treatment will not be particularly open about the fact that they believe these traditions or engage in these traditions. So there are several different types of curanderos or curanderex. I mentioned herbalist because I'm assuming that my great-grandma was an herbalist or a yerbera. What this means is that this practitioner has a specialty area in identifying herbs to use as medicines. And they may incorporate all of these other factors that these other types of curanderos, curanderismo practices that I'm going to describe here in a minute as well. So even though there are different types of curanderos and they have their specializations, oftentimes there's cross-study and cross-specializations as well as practicing kind of like an interdisciplinary practice. Another type of curandero is a huesero or a bone setter. We can think of this kind of like a chiropractor, but also these practitioners will reset bones that have been fractured or broken. And so this is their primary job. There are sobadores or massage therapists. There are parteras or midwives. And then there are espiritualistas who are spiritual guides. And as I mentioned, oftentimes there is overlap between these, and with things like yerberos and espiritualistas, those are kind of like foundational pieces. And then these other parts of being a huesero, sobador, or a partera could be additional specialties that one has. And I might be missing some here, so if anybody knows of additional types of curanderos, you can jump in or type in the chat. Oops. Okay, so we talked about the different types of curanderos. We talked about what curanderismo is. So let's talk about what types of treatment modalities are used within curanderismo. So earlier today we did Olympia. So this is a spiritual cleansing or a cleansing of a space. Typically what this involves is cleansing the body, mind, soul, and emotions. In Western medicine type of language or kind of current practices, we might call this like a grounding type of exercise or a releasing meditation type of thing, but it usually also involves herbs and burning of candles and other things. The belief is that through Olympias, you rid the spirit and body of any blockages. So again, I talked about the different chakras, and so we are wanting to create free flow through our mind, body, and spirit. And by engaging in Olympia, we're allowing for any blockages to be opened and released. And then because of the spiritual aspects of this, there are beliefs that you can be cursed, and that can be a cause of the illness or ailment that you're seeking treatment for. And the Olympia is a first step in releasing or removing a curse and treating that ailment. So oftentimes this is the first line of treatment, and then the additional strategies and modalities are added to specifically treat the ailment. It's believed that through Olympias, we experience an increase in feelings of peace and happiness, which makes sense if we're engaging in grounding and connecting with our earth and with our ancestors. The next type of treatment is a sobada, or a Mesoamerican massage. And there's different types of massages that can be offered. So what you see in this picture, on the bottom, you have a traditional massage with just rubbing and touching of the skin. And then on the top, you have ventosas, or cupping, that is happening. So many times sobadores will use multimodal type of treatment method. So it may be a Reiki treatment followed by acupressure, acu-detox, and then a full-on massage. And the idea behind a sobada is, again, to loosen up and open up any blockages in the mind, body, and spirit. With acupuncture that's done in Curanderismo, oftentimes they use needles from the maguey plant, which is a cactus. And so it's not the traditional needles that you would see with Chinese medicine, and really connecting with like the Mesoamerican plants and nature that was accessible to individuals in South America, the Caribbean, here in the United States, as well as Southern Europe. And then other treatments can involve pláticas, which is kind of like a talk session. So this is another first line of treatment that often most curanderos will do at some point or another, regardless of their treatment specialization. So this will entail a discussion of what their presenting concerns are, what they believe caused it, and then what sort of spiritual or personal interactions could be causing a blockage or a disconnection with the spirit. Whoops. And then another type of treatment is oraciones, or prayers. So as I mentioned earlier, during colonization, this type of practice got fused with Catholicism and Christianity. And so prayer is a big part of Curanderismo, and often used in chants or mantras, as well as can be included in like homework that the curandera assigns to the individual that is being treated. Tinctures are often used, and I shared that I have my tincture here, my rose tincture, as a way of using like aromatherapy. It could also be a tincture that you take orally to treat a specific illness or ailment. And oftentimes these tinctures are made by the curanderos themselves, or are made by another practicing healer, usually hierberos, who have a good understanding of herbs and their medicinal properties. And then similarly, there are pomadas or ointments, so things that you can rub on your body and use to heal and release any blockages in different parts of your body. Again, usually made by the curanderas and individuals who have a good understanding of medicinal properties of plants. Teas, very similar. So these are different remedios that are used. Mandas are often practiced as a way of prescribing something that the individual who is being treated needs to do. So if we think about this from a psychological perspective, this could be the homework or practice assignments that we give to our clients to work on in between sessions. And this can include all of the things that are listed above. So drinking teas, using pomadas, using tinctures, using prayer, as well as pláticas. Sweat lodges or temazcales are also a common practice as a way of cleansing the spirit, the mind, and the body, and can be used in addition to all of these other practices that I've outlined, and often in addition to things like limpias or pláticas as a way of really releasing what it is that you're treating. All right, I want to just take a pause here. I feel like I went through some of that information pretty quickly. I welcome anybody who wants to message in the chat, although I'm having a hard time finding it right now. So I may not be, oh, there it is. Okay. All right. If there are any questions or thoughts about what I've shared right now, you can go ahead and share those. We'll just take a little pause and then we'll continue on. So as I mentioned earlier, this is a pretty broad overview and very quick introduction to these topics. And at the end of this presentation, I will have some recommendations for resources you can use to do additional reading and learning on this topic. Okay, looks like there aren't any thoughts or questions, so I'm just going to continue on. So the next step in the process of this presentation is to talk about the cultural syndromes and how those relate to how we traditionally conceptualize client presentation from a Western viewpoint. There we go. All right, so I've got lots of information here. I gained this information from a talk that I went to several years ago in 2014 of a student whose mother was a practicing curandera, and she shared these insights about like different syndromes that present and are treated by curanderas and how they could potentially be classified by like a DSM diagnosis or a medical diagnosis. And yeah, Tim, so definitely there's some shared traditions with Asian culture as well. And you can see the blending as well with how Curanderismo is now becoming a little bit more modern with including things like Reiki, which are derived from Asian cultures. Okay, so let's look at this table on the left. So we've got nervios, ataque de nervios, empacho, mal puesto, susto, mal de ojo, and envidia. And then on the right-hand side are the descriptions of these ailments or illnesses in kind of our Western language. So when somebody is talking about nervios, me dio nervios, it's just this general anxiety, not necessarily GAD, but just the worries and anxious experiences that we often have during times of stress. Ataque de nervios, it can be loosely translated as a panic attack. And what we often see within Latinx communities is that ataque de nervios is a common thing and culturally accepted experience that often occurs at funerals, where you will see older women or people really having a serious attack of extreme emotions, llanto, so crying really loudly, falling on the floor, and that sort of thing. And typically when that is seen in the context of a funeral or something like that, it is not deemed to be an ailment or something that necessarily needs to be treated. Then empacho is more of a medical treatment. So this is like a pseudo-intestinal obstruction. Oftentimes this will present in young kids with empacho, so like constipation, the tummy aches, and they will go in to see a curandera and maybe get a sobada, a massage on their tummy, along with some teas to drink to help loosen up that blockage in the intestine. Mal puesto is also a physical disorder that is believed to be caused by envidia or envy. And what you'll see is there's a common theme with envidia being one of those negative forces in this traditional belief that often causes a break in spirit or a disconnect between mind, body, and spirit. And so oftentimes remedios like putting a red band on your head or a bracelet that is red are ways of protecting against envy. Susto can be described as a panic attack or a phobic disorder. Susto, directly translated, means fear. So this is a little bit more intense than just nervios or the ataque de nervios. It's more of that, like having intense fear to the point where it might be getting in the way of your daily life. Mal de ojo is evil eye, and this is something that's often talked about within the context of babies and being really cautious because babies are often draw a lot of attention, people looking at them. So within Latinx and Hispanic cultures, you may see that babies have wrist bracelets that are red and have the ojo on it, the eye, or may have a pin on them as a protection. This is also something that individuals really consider when they're traveling or doing something that may put them in a position where a lot of people are around them and potentially looking at them. Envy, I described that. So envidia, this is a negative force that can often cause an imbalance in the spirit, mind, and body, and can be seen through the way that the body reacts to it. I'm seeing some good conversation in the chat. So yeah, so susto is connected with PTSD. And then what you'll see over on the right-hand side is the desasombro, which is that severe case of susto. And that typically can also be classified as a PTSD type of presentation. And then Tom is saying Mesoamerican traditions are ancient. So again, those connections between like ancient Chinese practices or Asian practices, and then these indigenous practices, there's a lot of overlap for many different reasons. I think that it's pretty clear through history that Native communities, whether they're Native American or Native to Asia, Native to Africa, have a very concrete and clear connection with nature and with the earth. And many of these practices that you see overlapping really highlight that connection. So the energetic forces through our chakras, the connection to Mother Earth, to the celestial beings, all of that is seen throughout many ancient cultures and communities. Definitely. So a few other ones here. Espanto is another one of those things that can be very much related to like acute stress disorder or PTSD. So having a significant stressor or something that is really scary that happens to you might cause espanto, and that's a loss of spirit from having something scary happen. This can also happen in like a very, what is it called? Innocuous way. So like if somebody's hiding behind the door and they jump out and scare you, you might be able to classify that as espanto too, if you get into this really dysregulated state where it feels like there's a piece of your spirit that escaped through that fear that you experienced. So, and then we've got cólico, so the colic, that's a common thing we see with babies. Caída de mollera, that's the fall in fontanel. So with babies, their soft spot up here. Mal aire is an upper respiratory illness. Latido, heart palpitations, which might coincide with things like susto, espanto, or nervios. And then enojo, severe anger. So similar to envy or envidia, enojo is that high intensity type of emotion that can create a blockage between mind, body, and spirit. And this is why it's one of the syndromes that often gets treated with curanderismo. And then I just highlighted these pieces that really relate to mental health. So nervios, ataque de nervios, susto, desasombro, espanto, and enojo. And we could even say envidia, that I would say that there are frequent sessions that I have in therapy where envidia comes up. Envy, jealousy, whatever it might be, and how that impacts our mental health and our well-being. All right. I'm slowing down because I feel like I'm going pretty fast, but so this next section of the presentation is where I jump into some recommendations and strategies for identifying patients, clients who might really map onto these sorts of practices or might have beliefs that coincide with curanderismo and traditional practice. And the reason that I think this is an important discussion to have and why I'm really putting this at the end is that this is where we can really boost up our cultural competence and adapt the methods that we're using with our clients to be more receptive and open to thinking about how traditional beliefs and practices can be mended and blended into our systems and into our conceptualization of our clients and patients. All right, so first off, I'm going to start with things that you can use as indicators that an individual might be working with a curandera, curandero, or curanderex, and indicators that might tell you that the individual maybe isn't getting treatment, but might have some of these beliefs or practices just as part of their own spirituality and their own worldview, and how they approach their understanding of themselves in this world. So first we have these trinkets. I'm a bad Catholic and I forgot what these are called, but these definitely come from Catholicism and are representative through the idols and the saints that are often revered in Catholicism. So oftentimes these will be used as amulets of protection. A certain saint can represent a certain type of thing that might be helpful in treating an ailment or in providing protection. So for example, I should have brought it with me. My mama gave me a San Cristobal, Saint Christopher, when I went to do a summer research program in Mexico because she was really scared that I was going to be in the big city in Mexico City. And so she wanted to make sure I was safe. So I have that. And even though I'm not a practicing Catholic and I don't know what I believe in terms of the saints, anytime I go on a trip now, that little thing goes with me. And somehow it provides me with comfort. So these things can be really big indicators that potentially this is a belief system that your client or patient maps onto. Again, this is a potential thing. It's not a certain thing because this is also related to Catholicism, and many individuals who practice Catholicism also you have close connections with different saints. Then the use of herbs. So this one on the top is tobacco leaves, and then on the bottom there are different herbs shown there. So the use of herbs or the use of tobacco through processes of healing. So it might be ceremonies that they're engaging in, or you might hear snippets of practices that your patient or their family engages in. So if you ask, like, what sorts of things have you tried before? And they indicate, I gave an offering of tobacco leaves to this saint, that could be an indication that perhaps they map onto some of these traditional beliefs and practices. And then I talked about this. So this is an amulet that is often used as protection against mal de ojo or evil eye. You'll often see little kids and babies wearing these. And then oftentimes adults will wear them a lot of times when traveling or when engaging in activities where they might be interacting with a lot of different people. And again, the red is a symbol of protection. And that's why oftentimes these bracelets are made in red. I know a lot of times they're in blue, and I don't know the symbolism behind that color. Maybe others in this group do as well. Okay. Does anybody else have examples of things that might indicate to you that a client or patient might have these spiritual beliefs or practices? Another one that I can think of is just lighting of candles or having an altar at home for where people place pictures of relatives and ancestors who have passed. Ojos de venado are often used, yeah, Mary. So ojos de venado, you could unmute or put it in the chat, like what is that and how would you know that somebody has one of those or is using that? It's a seed that looks like an eye, yeah. So oftentimes these seeds are used on the bracelets that you see here, this red bracelet. This one is not a seed, but oftentimes instead of like the fake eye that we see here, it would be the seed instead that represents the eye. Yeah, thank you, Mary. Okay. So other considerations or recommendations. So I was updating my resource list and found that there's a recommendation, and I agree with this, is you should not directly ask if a person is being treated or seen by a curandera or curandero, curanderex, because oftentimes there's a lot of stigma, embarrassment, and shame around these sorts of beliefs and practices. So the way that I would recommend assessing this is by asking, what traditional herbs or remedies do you use or have you used to treat this problem? Generally, when I get a new client, I'm asking, well, what have you tried so far and how has it worked? So this is a different way of asking that question that is a little bit more opens up the door for more inclusivity of different types of practices. And yeah, Tom added like symbolism and metaphors are critical to understanding the cognitive aspects of ritual and ceremony. Definitely. So there's a lot of metaphors, and in my psychological brain, I tie this in with how we use metaphors like in acceptance and commitment therapy to help us kind of put together the cognitive and the emotional pieces to understand our experiences. So within Curanderismo, the symbolism, the metaphors are used in a similar way, but we're adding in the spirit. So mind, body, and spirit. Thanks, Tom. Other questions you can ask are, what remedies or remedios have you tried to address the problem? What symptoms prompted these like experimentations with remedies? And then if they disclose that they are seeing a traditional healer, you can ask more specific questions about that still allow you to be sensitive to their privacy, in the sense that you can ask, like, is this a treatment that you typically seek out for symptoms like this? Or is this a new strategy that you're trying for the first time? For myself, I am very new. I grew up knowing my grandma was a curandera. My dad would talk about different herbs. He would go to sweats, and that was pretty normal. And I have only received, I think, 2 or 3 limpias in my whole life from a curandera. So if I were trying to treat a symptom through this method, it would be something new for me. And there's reasons why I'm opening up myself to that sort of treatment right now. And so if that's something new to your client or your patient, you can also explore, wow, that's something new for you. How did you decide to try this out, and what prompted you to do that? And then we saw that there's a lot of diagnoses and labels for the ailments that are treated. So what are some of the labels that were used, or the diagnoses, to describe what it is you're experiencing? And now that you've heard some of that terminology, you can kind of piece together, okay, what might this mean in our Western world, in our Western language? And then, did you agree with these results and diagnosis or recommendations, and was it helpful? So sometimes people will completely feel like, yes, this is helpful and fully map onto the beliefs. Other times, I work a lot with kids and Spanish speakers, so parents will often really map onto these beliefs, and then kids are more acculturated to the Western viewpoint, and they think their parents are crazy. So having an understanding of their perspective of how well it worked, what they thought were the results and the recommendations, and how that fit with how they see their problem, can also help you contextualize that and understand, is this something that I can kind of weave into our treatment, or is this something that this client doesn't really relate to on a spiritual or personal level? The other thing to keep in mind is that oftentimes when people are being treated by curanderos, there might be observations of treatment resistance in our Western context. So a lot of times when people are getting treated by curanderos, they are instructed as one of those mandos, that prescription, to not talk to anybody outside of the healing space about what it is that they're being treated for. And that's very important for us to keep in mind, because we want to maintain the respect for those practices. And so in our conceptualization and framework of how our clients are presenting, if we know that maybe they have more traditional beliefs, and we see that they're not sharing a lot in therapy, or that they might be missing appointments, or just generally quiet, then we can use that information to conceptualize this as potentially a cultural factor rather than a resistance to treatment, if that makes sense. All right, and then lastly, with the recommendations, these are some books and some websites that you can look into. The one on the left by Rodolfo Anaya is just a novel. It's a nice book that introduces Curanderismo from a New Mexican point of view. And it's a really cute story. I read this book in English and in Spanish multiple times. There's now a movie about it. And so this is a good way to just kind of expose yourself to that cultural piece of it. And then the other resources that are here are more that academic, the academic resources where you can learn from a professional person who offers treatment and healing. What does curanderismo mean, and how is it practiced? All right, and then here are my references. I'm gonna go ahead and pause there. This is the last of my slides. And see if anybody has any questions. The QR code will be posted here in a minute for you all as well to get your CE credits. And feel free to unmute if you have questions. I also have the chat up.
I was just would say a few things. And so I'm Maria Yellow Horse Braveheart, and I really appreciate this presentation. And I was just thinking about the miraculous things that happen for our people who are involved in traditional healing. So I'm Hunkpapa no Wala Lakota, and it's just mind blowing, and and I'm very loyal to my people and our ways, but we also welcome other people and respect that too. So so I really appreciate this.
Thank
That
you.
you've shared with us today.
Thank you for sharing that. Yeah, I had this really, in your words, miraculous and intense experience of having like this spiritual support as I went into a recent medical procedure, and I had never had that sort of experience before. And it was really, truly like inspiring to me to further my studies and my understanding of these practices, because in those moments, I felt my ancestors enveloping me and holding me and allowing me to feel all of the fear and doubt and all of that, while giving me the hope that I could get through that experience. And it was like something that I'd never even experienced in a dream, much less in real life and in person. So it can be super powerful. And of course, I see my therapist as well. And so I see how it can be blended into these Western treatments, and how use of both modalities can supplement one another. So this happened completely aside from my individual therapy. And then I talked to my therapist about it, and we were both crying together discussing this experience, and became a further healing type of ceremony for me. So for sure. And then Judith shared that there's a sense of community that includes the spiritual in such a beautiful way. Definitely. It connects you with those pieces of you and your family that are no longer here on this earth, as well as to the broader community who practice these sorts of traditions as well. Thank you all for joining me today. We're out of time. I very much appreciate you being here and all of the thoughts and comments you've had.
Thank you so much, Dr. DeVargas.